Tnad Koit KHiah Jylla ni sngi kala Pynshai haduh mynta hi kimpat la ban pyntikna Halor ki Khubor ki bala phriang kylleng ba Jingpang Polio kala ki Biang ha kini Jylla hadien bala lap ye uwei khynnah badang snem tam na Tikrikilla ba udon ye jingshitom kaba syriem. Liang Tnad lyngba ka director but joint director ke MCH&FW Dr JS Mumin but Dr B Maulong kelaitu bautiu khynnah mynta udon ha Goalpara Civil Hospital but la debru ban shimi ki sample na kabenta ban pha test khnang ban pyntikna ba ka jingshitom ka ba udon ka dayniam na ka Jingpang Polio.
About the news report that polio resurfaces in India and case has been detected in Meghalaya, West Karo Hills, in Tikrikilla village. So there was a case of one child, 2.5 years old, from Tikrikilla who had weakness in his right lower limb. So he has gone to Goalpara Civil Hospital for treatment. There the child was admitted and was reported as acute flaccid paralysis case. So stool samples have been collected from there and the stool sample has been sent to laboratory, one to Kolkata IOS and another to NIB Mumbai. So we are waiting for the final report. Until and unless the final report comes, we cannot confirm the case. So the health department along with the support from WHO is doing the investigation and waiting for further results. In the meantime, our staff from WHO has also gone to Tikrikilla to investigate the case. They are collecting the samples and from the patient and also from the community to take further for further investigations.
It comes positive, then they'll have to do another test again, whether it's a circulated virus or whether it's a immunovirus. Because if it's an immunodeficiency virus, then it can happen only to one child. But if there's a circulated virus, then they'll have to do the screening for all the communities, for all the contacts, for the family members, So they'll have to see all those stool samples of those people also. Then after that, when the report has come, whether it's a poliomyelitis or whether it's due to other causes, because as it is for surveillance, for this surveillance, we used to do this fever with rashes also for measles, and we are doing this AFP search also, by the team from district or the team from WHO or not. So right from before, when we were in the PhD level also, we got that instruction that when there's any case of paralysis of lower limbs within 6 months and below 15 years, we have to inform the WHO team to come and take stool samples of that particular patient, so that we can rule out whether it's polio or not, because there are many acute flaccid paralysis due to other causes also, not only polio. So since now why we want to clarify, since it has come in the media that poliomyelitis resurfaced in Meghalaya, now at the moment we cannot say that it's polio, because we are doing surveillance for acute flaccid paralysis. So this is the case of acute flaccid paralysis. So we cannot say all are measles, but it can be due to other causes. So for acute flaccid paralysis also, it can be due to other causes, many other causes.
So this is just a routine investigation.
Even this child also, she got two doses this year. But sadly, it seems according to the investigation, they never used to go for immunization, only during polio.
They don't go for routine.
The problem we are facing here in Meghalaya is that many are refusal cases. Well, during polio program also, we had experienced abuses, we had experienced spitting, we were chased by the dog also when when we went house to house also, said that this is a real problem with Meghalaya. Many refusal, like some they completely refuse. Not only vaccination, even like for hospital deliveries, they like for anything from the government. Also recently we are facing that problem, especially in East KHiah Hills, in Southwest KHiah Hills, West KHiah Hills, West Dinta Hills, East Dinta Hills, we are facing. They refuse any help from the government. So during polio time, because this year also we are conducting on the 4th of March, the same thing we are facing. So, but even then, the search we are going on, like it's a daily task for us. We are doing the search every day for measles, also every day for AFP, and we are instructing the district also, please send your AFP surveillance report, please send your fever with rash report. So, regarding this matter, the WHO state surveillance officer from Shillong, the state surveillance officer from Bangaigaon, the state surveillance officer from Bakita, that along with the health department team from West Karo Hills, now they're conducting all the investigations, they're conducting all the search and all the collecting the stool samples. So now they'll be giving the update every now and then. So by the time when the result has come, then the WHO will confirm the case.
Okay.
One, like the last case, it was in 2011. And then India was declared polio free in 2014. But last year there was a case in Afghanistan and Pakistan. So in India they could detect only, I think in 2021, only from the sample from the sewage. Not from the person, but from the sewage they tested, because this surveillance it's not only from the person who are suffering like the paralysis. They are doing the testing from the environment also, like from the sewage also. So I think in 2021 they found in Calcutta. So, but that one it didn't affect anyone. So but regarding the search for this AFP cases, we are doing daily. I mean, it's a daily basis from, like for all, we instructed the aliens, we instructed even the Aisha to, if you notice any child with weakness, you can notify to the PHC doctor, and then we are doing search not only for AFP cases, we are doing for measles also, because any fever with rash also, we are conducting survey for that also. And if there's any if there's any fever with rash, we send the WHO team to go to take the investigation and to take the blood sample.